Hi, everyone, and welcome back to BCA Coral podcast. Today, we're joined by Sindhu. Can you introduce yourself for us?
Hello, I'm Cindy. I'm a dental therapist and hygienist based in London.
Struggling with your A levels in science, maths, or economics and worried it might cost you a place in dental school? Today's episode is sponsored by Harrier Tutoring, a support system that removes the headache and gives students the structure they need to hit top grades. Visit harriertutoring.com today. That's HARRIER tutoring.com.
Great. So, can you just tell us a bit more about your journeys and how you got where you are right now?
Initially, I wasn't one of those people that was like, I woke up and decided I want to be a dentist or something like that. I wasn't never like that. Or I didn't have I had braces when I was a kid and I saw it and none of that stuff. I just knew I was the type of person that wanted to be everything. Like I'd go in the test and be like, I want to do that. And then I'd see a firefighter be like, I want to do that. So I just had few bits and pieces. So I knew that I definitely wanted to help people in some way. And then slowly it stemmed down to I want to do something in STEM. And then it stemmed down to healthcare. Like it slowly stemmed down. And then I thought of was nursing a good choice? Is medicine a good choice? And then I found out about dentistry and I was like, hmm. But then even with dentistry, I was like, there was few other options I was looking at. And then I heard of dental therapy, I think on online somewhere, and I was researching, I was like, wow, this is like the best of both worlds. And I'm one of those hyper fixated people, and I saw it, I was like, that's me. So that's how I just decided instantly. And then, but the journey was a bit long because initially when I applied, it's like there's usually 20 something places in uni. So it's super competitive. Like thousands of people apply and 99% are dental nurses. So when I first applied, it was everyone in the interviews was just like, yeah, I'm a dental nurse with 15 years experience. I'm a dental nurse with 30-year experience or 2 years. They have all these experience and knowledge. And I was just there like, I'm good to go. Like, what do I do? So it was really difficult. And then I think the second time I applied, I managed to get through. So it was long winded, but I was like, I just wanted to become a dental therapist so bad. So yeah, it was a long winded journey, but somehow we made it through.
Yeah, that must have been really nerve-wracking. And I've heard all about the competitiveness, dental therapy and hygiene, because there's very limited spots and very few universities across the UK that do it. How did you handle your nerves and how was the
Think nerves wise, I wasn't too nervous. It was mainly the fact that, when you really want something, so it's like that little pressure that was there. But interview wise, because I've always worked in retail, so I've worked in so many retail places. So I used to go to do interviews for fun. So I really recommend that actually. So I'd be applying for random supermarket jobs, random retail jobs. So I was so used to going to interviews that I kind of knew how to get the job for the retail spots. So when I was doing dental ones, I was like, same to same, I'll figure it out. But then I did my research. So I knew what I had to say, the NHSCs and all of that. I knew round about what to say. I think it was the main thing is being confident. So I was just on the outside, I was just confident, if I get it, I get it. If I don't kind of thing. So I just knew what I had to say, what the basis was. I knew why I wanted to do it. I just researched about the uni and stuff like that. So when I went, it wasn't too bad. But I think the MMI, the multiple stations and stuff, that was a bit scary because I'm thinking, all these dental questions, they're like, so tell me how you'd go from A to B. And I'm like, what's that got to do with anything? But okay. And the fact that I talk too much, I think that was also my side. So there'll be 2 minutes and I'm like, so we'll just be having a great conversation. Like, oh, I want to go to the next station now. So as long as you can talk and you're genuine, I feel like that, even in this field, I feel like your personality makes a lot of it. So know what you're saying and say it confidently.
That's really good advice. I agree. I think confidence is the most important thing, and just making sure that you bring your true personality out there instead of trying to hide it or just be very professional. Because then, at the end of the day, the interview see the same answers again and again. It's your personality that really makes a difference.
Yeah, professionalism is very much needed, but you can't be a robot.
I agree. So, what university did you end up going to?
I went to University of Plymouth, Peninsula Dental School.
And how was your experience there?
It was, I think, considering it's one of the top unis, I think we were taught immediately from year one about clinical skills. So since year one, we were shoved into clinics. So we were we were, I think our group was the last year where we were like practicing like LA on each other and everything, doing exams and everything from day one. So I feel like we had such a variety of ways we were like challenged. So we had like obviously like clinical exams, we had courseworks, we had group works, we had MCQ style exam. We had like exams from every direction, every type of exam you can have. So even if you like lacked in one way, you'd work better in another way. Like you had everything. So I feel like overall they did such a good job with that because I know I'm more like good skills, so I could like work hard on my time on the other stuff like that. And we also were integrated with BDS students from the day one. So even in final year, it made it so realistic on how we work right now. So we'll get a treatment plan, we'd be able to liaise with the dental student. Okay, I'm gonna do this filling. Would you be able to do this root canal? And we work together as a team from the beginning, and we also partner being your nurse and everything. So once we came into I was so used to that mind, and that's how it is in the real world as well. Like the dentist sends meets and then stuff like it just works all together. So I feel like they prepped us really well for uni, like from uni to now.
Yeah, it's really good. I've heard that Plymouth tend to start with stuff early. So what did you do in first year in terms of clinical skills?
In terms of clinical skills, so we started off doing a lot of exams, 3 hours on one patient doing an exam.
Oh, wow.
Yeah, and we practiced it on each other. We did obviously doing play on each other. We started our like skills with doing class one, stuff like that. So like learning like how to do class one and stuff like that.
Great. So if you were to be able to go back, would you change any part of your application or like choosing your dental school, or are you happy with the way it's gone?
I think I'm quite happy with the way it's gone, to be honest. I feel like for me, like I feel like a lot of people have very stressful processes. I feel like mine was very good, especially like we'd be like whoever I interview, we become friends. We're all texting each other like, "Have you got this? Have you got that?" Which is very helpful. Obviously now it's like different. 'Cause I see people asking on TikTok like help or Instagram and making Facebook groups and stuff like that. They probably had it back then, but like I was not really a social media type of person. I'm more of a Snapchat babe. So I was like, I wasn't really on like Facebook groups, like checking or like student room. I don't use that now, but I was like checking up on that and stuff like that. It wasn't as easy for me to like compare, like see what else is going on with, but yeah, it was for me, it was because I was just me in my isolate part. It was quite straightforward for me. So I didn't really like worry too much. There's nothing I'd change to be honest.
Okay, that's good. Do you think there's a difference in the patients that you've seen in dental school in Plymouth compared to now in London?
Yeah, for sure. So in Plymouth is very high patients, really a big struggle there to get finding an NHS dentist there is like a huge thing. So we have backlogs of patients that are waiting to join the free dental school. Whereas in London, there is some places that need it, some places don't need it. Like in my dentist, we're like quite reoccurrent with like hiring NHS patients, and it's very different because it's free, there's one vibe, and then here it's like you have to learn about the finances, which we weren't taught. So I was like, what do you mean I need to tell you the cost? And they'd be like, oh, so how much does this scale and polish cost? And I'm like, I don't know myself. Like, let's find out together. Like, if it took me a few months and you're just remembering numbers, it's difficult. So I was like, they like, okay, I'm doing this metal filling. You could get this white filling. How much is the white filling? I don't know. So it's like those kind of finance things was a big thing for me. That took ages for me to, or certain practices don't do everything. They might like you might not have a perio specialist, and because we're so heavy with hygiene, if someone has needs the periodontist, you don't have it in house. You need to know who to refer to, stuff like that. So like currently, like one of my practices, I refer to Rena Wadia. In another practice, I'm like, who do I refer? So it's like those kind of things, like slowly, like you start learning about little things that you weren't taught in like school, right? So it's like those kind of little stuff I have to deal with the patient that are so different, and also timing, like you don't have 3 hours anymore. What do you mean I have 10 minutes? Like it's just those kind of stuff.
Yeah, that's really fair. Do you think it would have been useful if during dental school they like let you have like a week or two like working in a practice just to see how it is and how everyone works together?
But yeah, so and now I believe they started doing that just after I left.
Oh, okay.
Yeah, so I think now that they've started like cooperating with that stuff, and I know we do get like a training to go to like maths facts and stuff like that where you're just, but I think going into an actual busy practice makes a world of a difference. Even though you do probably do it in work experience, but when you know all the ins and outs, then you're like more wide eye open, and you're just like, okay, so that's how that's done. That's how I can do this stuff like that. And even now, I still do work experience, which is kind of weird. But like even like let's say I'm joining a new practice, I request work experience and I watch how like the hygienist therapists there how they do it, and everyone is different. Like you'd think it's a straightforward job for like one thing, but every clinician has their learn so much. Like every little thing that you can learn. Like I'm just there writing away, and then like, what are you writing? Everything. Like there's so much that you learn. So I still think even now that it's worth like shadowing people.
That's actually really useful. So, what is the difference between dental hygienists and dental therapists?
So with dental hygienists, we primarily focus on the prevention side. So a lot of people have this thing that like, oh, they're just cleaning the gums, where it's just like there's more to it. If someone has, let's say they have like quite bad periodontitis and they're aesthetic treatment, you can't just straightforwardly get composites when your gums are bleeding. So it's about like prevention, like helping the patient in the long, getting the oral hygienist, like hygiene sorted out. In terms of therapy, you have a bit more clinical skill. You can do stuff like fillings, stainless steel crowns for peds, pulpotomy, children's deciduous teeth extract, and even with filling that composite bonding, fillings that aren't too close to the nerve, taking x-rays, stuff like that. So it's a bit more wider than doing hygiene.
Do you have a preference between the two, or do you like both equally?
Currently, I like both equally, but I think I tend to kneel towards the therapy just because it's everything is different. Like, even with hygiene, you do have everything different. Like you might have one patient who's like everything that I told them to do, and it's quite straightforward, and someone else we have to like have a bit about how to like give them a more tea. But with therapy, it's like every patient. Like 1 minute I have a child where I'm like playing games, like come on, let's get to it, and then you might have an older person who's like doesn't care about what we're doing. We got to do this filling, and they might like like each patient, like everything's like different, treatments different, so you're like constantly on your toes. But with hygiene, I feel like can get, because I'm doing it mixed, it makes it better for me, I guess.
Do you see the role of dental therapy and hygienists changing in the next few years, or do you think it'll likely stay the same as it?
I think it's constantly like evolving, which is the good thing. So what talks about like allowing us to do prescriptions and stuff like that. There have been other talks where like there's like little things that they might want to change, but because even though therapists have been there forever, people are still, even now, still discovering what dental therapists are. Like, even people I introduce myself as a dental therapist, they're like, are you doing yoga with the patient? Am I doing like a logical thing? Like, I'm not lighting up candles and stuff like that. I have to tell them like such a clinical role. And then I do the same speech like so regularly. And you'd be surprised, a lot of principal dentists and like places I go to interviews, even they're like, what is a therapist? Like, you do you work with kids? What's going on? And I'm like, no, like I don't know the scope of practice. So I'm constantly saying stuff. So I feel like now more recognition, and we have our boards and everything who are like trying to do new stuff all the time. So I feel like it's constantly evolving, and there's always like courses to learn new stuff and everything. So even if you want to get into aesthetics and stuff like that, so it's quite an evolving course.
Do you think that dental therapists are underutilized in the UK?
100%. Because if you were to like, I'm sure a lot of other therapists would agree, would you even apply for jobs, it as a hygiene and therapy job, when you go there, it's always hygiene, and they do therapy, but most of them don't know what therapy is. And then every time I'm gone, a lot of places where I have to explain what the therapist does, like how they could incorporate us into the work, how would be beneficial, how we can like share the load, and then dentists could do more other things compared to like if they weren't doing the fillings, they could be focusing on all the other treatments they could do. So I feel like we're not as utilized as we can be. And there's a lot of successful places where, because they're utilizing the therapists, it's more beneficial to them. So it's just about finding out like what we can do, how we can do it, training together and making it applicable to the practice. But then again, it also depends on the practice. So if you're like a practice that, I don't know, just like focused on any, it'll be a different route. Not quite straightforward for us to get a performer number. Whereas if you get like another dentist, they could like share the workload. So some people feel like different roles. And I've also had seen like some dentists that I know that are, they apply for the therapist job because they'd rather just do the fillings and stuff like that. So I'm like, it's a bit of both, but I feel like we are quite not utilized.
That's really crazy that even like practices don't really have that much information, like your scope of practice.
Yeah.
Like you're just constantly kind of bigging yourself up.
I do my list like, okay, guys, here's what we do.
So, what is your favorite procedure to do on a patient?
There's so many. I think I like doing like a juicy perio where like removing everything, especially when they're staining and everything, and they're just like, oh my gosh. And I'm like, let's keep it this way. So I do like that. I do also like composites. I feel like it's so fun just removing everything, especially when it's like quite deep and you're just like, I feel like it's so transformative, especially like sometimes when like you've done everything and it's just like showing it to them and it's just like it's quite rewarding. And with our career, especially it's like black and white, you see the results immediately. Like, it's not like you're waiting for like targets or anything like that. Like extraction, you pulled it out immediate. Everything's very immediate. So you see the results. And especially when like you get positive feedback, it's very like reassuring. So that compensates and juicy periods.
That's a good. Have you ever felt like your scope of practice was limited by practice culture rather than the regulations? I think you touched on it briefly before, but
Kind of. So they're because like I said, because they don't know what we do, they're like they might feel like, are you allowed to do that? Are you sure you're allowed to do that? So like one of the first practices I joined when I had to do my hygiene appointment, I had to administer LA and I was like, let me crack on with it. And then the principal was like, every time you need it, come and do it for you. And I was like, what do you mean? So it was like, because they weren't sure. And then obviously they want to be safe. And I'm telling them like, so there are stuff like that. So there are places where, because they don't know, I can't really blame them that they don't know. But then it's about like teaching them. But yeah, so it depends on the practice, to be honest.
well, how did you navigate that situation? So you end up doing the LA the first time. Did they like want to watch over you to just make sure that you're doing it all good?
We ended up not needing LA at that point. And then after like I've managed to get a different job. So then it was just like I had to leave the job. It was quite far for me anyway. So it was a switcheroo. So it kind of worked in favor. So I never really got to like get over the situation. But it was a bit weird because imagine you're doing treatment and someone else admit it's like I'm in uni all over again.
If you're enjoying this episode right now and you find it really helpful, it would mean the world to us if you could just follow or subscribe wherever you're listening and share it with someone that you think that this would be really, really helpful for. That way we can bring on more and more guests and share more of our stories. Anyway, let's get back to the guest.
Do you find it demeaning when the dentist, like the practice manager, thinks you're not capable of doing certain procedures?
Yeah. So especially when you've just graduated and you're quite doubting your capabilities. And because I haven't done a foundation training, it's now my time to practice everything and do it in the real world. So when you're undermining yourself, like thinking, am I good enough for this? Am I good enough for that? And someone else is doing it at the same time, it kind of doesn't help you in the right direction. So as long as you know what you're doing and you can say like, you have the proof, you know what you're doing. So it's just a matter of being confident in yourself, and then that kind of helps with it.
So, did you do foundation training? Okay, so how did that go? So it must have been quite stressful to have to like start a job without having that foundation training. That's usually
Yeah.
recommended.
So with dental therapists, it's optional. You don't have to do it. And if you do choose to do it, it's very limited. So I think like London would have like 1, 2 spaces or something like that. There'd be like one in Birmingham, that would be like 1, 2 spaces. Like everything's so like minimal. Same as getting into uni, everything's very minimal. So I did apply, but it was like it's very hard to get into. So I wasn't too focused on that. And especially because I'm just coming out of uni, I wasn't really bothered to start working immediately anyway. So in hindsight, even when students message me, I always say apply anyway. Like it's so worth it. Like all the studies and all the courses you go on to that are worth so much money that you get to do, so much knowledge, someone helping you all the time. But at the same time, like I said, because it's really difficult to get into, and if you don't get into it, it's not that deep. Because like in my situation, I'm always going into all the dentist surgeries and asking them questions like, oh, okay, I have this feeling, how do you think I should go about it? Or like I had to build up this upper five, and I was like, haven't done that before. What do you recommend? How do I do this? What matrix band do you use? Is there something you do? What bird do you like? Like I'm always going into the dentist and asking them questions, and most people, actually, in my case, all of them, they're always happy to help. So it kind of works in my favor because I could just go and ask someone, and especially because I'm working on a referral basis, I could just go to the dentist, or they just tell me like, okay, we have this coming up, do it this way, try this technique, try that technique, try this clamp instead of that clamp. Like I'm like anti-wingless clamp over here, and they're like, no, try this one, it'll be better for you. So it's like stuff like that. So they just give me tips and tricks. So even though I'm not doing training, I still feel like I'm getting training with like all these people that have like years in experience. So they will give me this buckets of knowledge. So it's still helpful for me.
Yeah, it's great that you kind of have a mentor in your practice who is able to help you. So what do you mean by referral basis?
So currently I'm not doing direct access. So a dentist would see the patient, formulate a treatment plan, and then they would like, let's say the patient needs 3 filling, they need perio, they need root canal, and they need an extraction. They would liaise with me. So they'll do all the stuff that they can do. And then they'll send me over the video, for example. Or if they see a child and done the child exam, and then they'll send it over to me, facial sealants or anything else like that. So we work together. All the dentists in my practice send me the work with them. Do it together.
Oh, okay, that's quite good. And so are you the only dental therapist in your practice?
No, it's me and my bestie. So the two of us, she's currently on maternity leave. But currently right now it's just me. But yeah, there's 2 of us usually.
And how many dentists are there in the practice? So, like, what's the ratio usually?
Probably I don't know, like 8.
Oh, okay.
I should know that. That's so bad, but I should know 8 or more. I don't know.
Okay. So it's like for every 4, there's like 1 dental therapist. Do you feel like there's like a lot to do in a day? Like, do you feel like you should be like probably given like 1 more dental therapist, or do you feel like it's manageable for now?
I think it's manageable for now, because especially because I work on a basis, you can't anticipate what you're getting. So like with my hygiene job, for example, I'm booked for ages. And like when patients come to immediately again, I'd be like, oh, like, I don't know when I'm free next. Like it could be next month, it could be like whenever. It's super busy. But with therapy, because it's like each patient just has a few treatments to do. So it's like booked for like the next 2 weeks or something, sometimes 1 week. Like it's very weekly, can be different each time. I except for the private treatment. So when it comes to NHS stuff, it's not as heavily. So I just know that for this week I'm gonna be busy. Then the next week I know the next 2 weeks I'm gonna be busy. So it is very busy, but it's not like in advance. So I feel like it's manageable, yeah.
So you mentioned a bit about feeling a bit stressed out or underprepared when you just came out of university. So how did you handle the like imposter syndrome? That's what you'd call it as a new grad.
I think initially, because you're so fresh out of uni, and especially with uni, follow all these gold standards, everything you get the nice Fuji and everything to use, and then you come here and they everything NHS dentistry is completely different, private dentistry is completely different. Each practice is different in its own way, and having worked in a few practices, you see that each practice likes their own way, so they have their own values, their own ethos. So you're just trying to it accordingly. Like for example, coming from uni where you have all this time. And then each time I remember my clinician saying, like, Cindy, you won't get the same time. And they support me. Like, time management used to be my weakness. And then here, when they give you like all the time, you have to be able to say, like when I started, I was like, I can't do a filling in 5 minutes. Like, I need some time. So initially I was like, be patient with me, give me 30, 40 minutes, and then we go accordingly. So I'd be like, for hygiene, I need like a good 45 minutes. And they're like, can you do it in 30? So I started with my long appointment hours. I'd love to go back on my diary and see how long I used to take. And as time goes by, like, like when you come back from summer and you're going into uni again, you're like, how do I hold a pro? It's like that. So you're just completely in your own world. As I got a hang of things, and I'm like, okay, I could shorten it, I could do this. And now it's like Speedy Gonzalez over here. But it's just like a matter of time. So that was one thing. And another thing, also like treatment, like especially recall, like in uni, because you only have like a few patients, right? So I'd be like, okay, so can you come back next week? Can you come back tomorrow? Like the recall, with those really a recall, because it can't be like, I'll come back 6 months time, because then be like, oh, so maybe like I used to bring back patients just to polish their composites and amalgams and stuff like that. Now, like it's my patients, and they like it was such a weird moment when it was like 3 months later, my patients came out, but like, you came back for me, and it's the same patients that coming again, and all these patients have like a really good connection with that, are like coming every 3 months, coming every 6 months, and I'm like, how's that baby doing? Like, this is so crazy that you're coming for me. Like, I forgot that I was a clinician, and they're like, you're coming to see me? Like, it's so crazy, because even still like practicing things, I'm going on these courses trying to figure it out. And when those people come back and they're like, yeah, Cindy's my hygienist, that kind of thing, it's just like, wow. And when they leave you those Google reviews and stuff, it makes you feel so much better. So initially, like, even now, I still get that imposter syndrome at points where I'm like, oh, but it slowly fades away, especially because as long as you love what you're doing, you just crack on with it.
That's some really good advice, and it's really key to have a good relationship with your patients. What is your like top tip on building relationships?
I think honestly, assess the vibe. Like, especially if you feel like, for example, if someone comes in that's like super quiet, you're not gonna go in there like speaking so much. And especially with me, I could yap for days, so it's not the best. Especially in uni, I learned that like I'd have patients that just some patients want a quiet, come in, do the thing, go. You need to assess the vibes. Like I'm there, I'm like, hi, I'm Cindy, da, 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 da. And it's just like, whoa, scary. And another thing is most of the patients are scared. No one has no one really ever comes in like, can't wait to go to the dentist today. Like no excited like that. So you need to assess the vibes, make it comfortable. And I think like as much as definitely be professional, but also show a bit of you. Like I was be talking about the most random things, just vibing, just being normal, reciprocating what they're saying, really listen to what they have to say. Like they might just some patient love to drop the craziest law to you. So you just be listening to them and you just make it like a comfortable environment so they feel like they could talk to you and be relaxed. Because I feel like, especially with me, like I've been in some random mad colored scrubs, just there waiting up for you, and they're like, oh, like you just see the shoulders relax. Like she's this random girl here. So you just have to be able to talk to them, vibe with them, see what they're into. Like I'd be playing some crazy music, whatever's going on. They'd be like, what song is this? Like, you just like talk about random things. Like, don't make it too clinical, because then it just gets a bit like it's just like very formal and black and white. Like, just be a bit more relaxed. Talk about other stuff. It doesn't have to be 100% dental environment, you know?
Where do you see yourself in 10 years' time?
I have no idea. I'm such a spontaneous person. I'd be doing one thing now, next thing. Like, if you saw me 10 years ago, I was a completely different person. I evolve every few months. You need to keep constantly changing. So I feel like 10 years, that's crazy.
I'm a whole decade.
I have no clue. I know I definitely would be somewhat in the dental field doing, I don't know what, but like maybe reducing my days probably. But maybe also like having like enough time where I have time for myself as well. Cause right now I'm so focused on like working, making sure that I know I'm confident in all the stuff I do. So I'm constantly like doing most days, like I'd be doing 4 days and I'm doing 5 days and I'm back to 4 days. Like it's very hectic. So I feel like maybe having more time for myself. But knowing exactly what I'm doing, that's a bit crazy. I'm not that prepared.
I feel like in 10 years' time, when we ask you this question, you're going to be like in like a different country, like a lawyer or something. You never know.
I've been my cute cafe that I opened, like selling cute pastries, and then on Tuesday doing my little hygiene job and coming back, something random like that.
We
Maybe
love.
yourself in 10 years.
I just want to graduate. I see myself having graduated, and I actually don't know either, to be fair.
Yeah, I think
Anything can happen. I literally love the idea of like having a cute little cafe that's just mine and just like being
yeah,
up
say,
all the cute little coffee drinks.
I said that once to one of my supervisors. He laughed so hard that he cried, and I was like, listen, this is why I can't tell you too much.
Yeah, like what do you mean?
Yeah, like my idea and visions change all the time. And I feel like it's more wiser to have short-term goals because then as you reach it, then you're like, okay, what's next?
Yeah,
Like you, for example, when I was uni, I was like, tunnel vision, just give me let me graduate and you won't hear the end of me. And the moment I graduated, I was like, I don't want anything to do with dentistry right now. Like I need my home, my family, stuff like that. And then I was like, okay, I need a job. Then I was like, okay, no, I really want to get better at composites. And then I was like, it's always changing. So you're always changing your goals in different places. Now I'm like, I kind of want to be a baker. It's always changing. So I think having short term goals is
that's true.
more wiser.
So, what would you say was your most memorable patient?
Probably my first ever filling patient where he didn't know it, that it was my first feeling. And I'm not about to, you're not going to be telling them, like, by the way, this is my first ever feeling. And it happened, like, everyone was trying to get their sign, like, you have to get your target signed off, right? This was my first time doing it. So I was like, "Ooh, what do I do?" And this was like on a random day where we had like new supervisors and everything. So I was like, sir, it's my first one. Can you help me? Like, I'm scared. And then he was just there, like, you got this. And we've practiced it 1,000 times. You know all the theory, you've done the practice, you passed everything. So it's just the fact that it's a real cute. So I was like thinking all over, like way too much. Got the etch ready. I got this ready. Like everyone move, everyone move. I got this LA like just there waiting for me. Like it was too serious. Like now that I think about it, it's kind of funny. But back then I was like, I'm doing an ID block. No one move. No one talk. And especially because you can see all your friends are like just there. I'm like, let me put my vibe. Don't even look at me. Like it was
Trying to lock in, like,
locked into the core. It was too serious. And then I remember doing it, and after that, I was like, listen, I just got a feeling like this is crazy. Like I was just like, it's so crazy. And then I ended up seeing him for the core like 2 years or something. And then I think like, especially with like as a patient, he taught me so much. So like I learned the contraindications of like how asthma like can affect the dental procedures, how sleep apnea affects dental procedures, how like depression affects dental procedures. I learned so much through this one page. Even at the end, I was like, my first feeling. And he was just like, we built such a good bond over it. And over the years, like I watched his smile change, his gum disease change. It was such a wholesome thing. And I learned about his family. Like it's so wholesome. And I'm like, and that's one of the million patients you see, right? So he's quite a memorable patient.
that's really sweet, especially that you got to see him more across the whole like 2 years.
Yeah, because he ended up needing more treatment. And then I managed to like refer him back to me. So it worked like crazy. He was also like one of my exit case patients.
You made sure he was your patient. Like you couldn't let anyone else do him.
The stars were aligned and it worked out.
So in terms of uni, how did OSCEs go? Do you have any tips for any students that are struggling with that right now?
I think OSCEs, it can be quite scary, especially when you have to do like everything's timed. They put out buzzes and they're like, okay, you have 5 minutes for this station. You're like, so I think the main thing is one, practicing out loud. So like have a group of friends or like you can even talk with ChatGPT or like even with family or friends or someone, especially if they're non-dental related, it makes it easier as well. So like when you're trying to explain procedures, definitely make sure you know how to do your medical emergencies, like your ABCs, like the whole process, just like you can like I used to simplify every medical emergency onto a little postcard, and then I'll just be there like you can just Like, okay, cool, I'm locked in. And don't overcomplicate it. Like, you know what you're doing, so just don't overcomplicate it. If there's stuff where you have to write like in a legible thing. Don't go like boom, 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 boom. Like, don't go crazy with it. When it comes to procedures, be very like systematic, do in a proper order. Like, make sure you like still wash your hands, make sure you still don and like all your PPE. Make sure you introduce yourself in like, hi, this is my name, this is what I do, or this is what year I'm in, stuff like that. Like, people always forget. And also make sure you show your empathy and stuff like that. If it's like you're breaking bad news, like you're listening to the patient and stuff like that. If there's things like smoking cessation or like patients who are like alcoholic and you're trying to give them cessation, those kind of things, they give everything for you. So it's just about being like going through a routine, stuff like that. So it's very much, it is quite straightforward, but I feel like most people tend to overthink it. So just have like set days where you practice like all the medical emergencies, all possible treatments that could happen, and then you can like figure out how to do it.
So how long do you think you have to prepare for an OSCE?
So it depends on the uni and how much they require of you. But because most of the things you probably would have known anyway. So even if you start like a month or so, I feel like that's enough time, to be honest. And especially if you're working with your friends and everything, you all would like put bits and pieces together. And especially asking people in the older years is quite helpful as well.
That's really useful. I actually have my first ever OSCE coming up, always in April, quite far away. But it's like the first year that Kings have started OSCE again, as for a while they did not have it, yeah. And they've like got it back in again this year.
Girl, message me, I got you.
I will message you. But these tips were really helpful. Thank you so much. So to end of the podcast, we'll just ask you a little fun question. What is your favorite Tamil film?
I don't have one. I have a million, but I'd say top 3. So many. I'm gonna go with Sachin.
Okay, yeah. Gilly is such a good film. That's like one of my favorites. And did you watch the re-release of Parippa?
Yes, of course I did. I was there in Wembley screaming my heart. I whipped out my foot. I did the works.
Wow.
It was amazing. Yeah, I hope they re-release everything. And I even watched a re-release of Pokiri, re-release of Sachin. Like, it was all too good. And especially childhood movies, watching it again on the big screen, it was like, fangirl moment.
It literally feels so nostalgic. It's so crazy to see like the vibes in the cinema. Everyone's screaming, everyone's getting excited, everyone's like singing the song. Thank you so much for joining us this episode. We hope you enjoyed it. I hope all the listeners have got a lot of good advice from this episode, learn a bit more about what dental therapy and hygienists do. We'll see you at the next episode. Bye.